If you want to know all of the extremely high yield points and everything that you need to know about lung cancer for the USMLE Step 1, Step 2 CK, and for the USMLE Step 3, then please be sure to watch this video until the end. And if you like this type of content, please be sure to power up that like button, hit subscribe, and that notification bell. And don't forget to become a member of my channel by simply clicking join. That will allow me to create even more high yield videos just like this. Now let's get into the extremely high yield review for lung cancer. So you can think of lung cancer into two main groups: non-small cell lung cancer and small cell lung cancer. For non-small cell lung cancer, you can think about four main types: squamous cell, adenocarcinoma, large cell, and bronchial carcinoid. While for small cell lung cancer, of course, you have small cell lung cancer. For all USMLE Step exams, examiners love to test the epidemiology surrounding lung cancer. So it's very easy for you to get those questions mixed up because they are so similar. But let's break it down. So if you have a question that asks you about mortality, all you have to think about is that video game called Mortal Kombat. So if you look at this image right here, you can see that the L is highlighted in red and the C is also highlighted in red. And then in the center, you can see something that's very familiar, right? Some gonads. So the mortal in Mortal Kombat should clue you into the fact that we are talking about mortality. It is extremely high yield to know that lung cancer is the #1 cause of cancer-related deaths worldwide. So as you can see here, lung cancer is the #1 cause of cancer-related deaths for both men and women. And for the #3 spot, we have colon or colorectal cancer. And that's what the C stands for. But it is different for, well, #2 is different for men and women. For men, the #2 spot is for prostate cancer, while for women, the #2 spot is for breast cancer. But just remember, Mortal Kombat, the L and the C are highlighted. And in between those two words, just think of sex organs or gonads being there. And think that the #2 spot would be different for men and women, but #1 and #3 are the same. So for men, #1, lung cancer, #2, prostate cancer, #3, colorectal cancer. And for women, #1, lung cancer, #2, breast cancer, and #3, colorectal cancer. If you like that Mortal Kombat mnemonic, then please give this video a thumbs up. And if you have any more mnemonics that you want to share, then leave them in the comment section below. I'd love to read what mnemonics you come up with to remember difficult topics. And next questions that examiners love to ask because they think, hey, everyone will confuse like cancer-related deaths versus the incidence. So we're not going to do that here because you're watching this video. So all you have to know is that the lungs are inside. Lungs are inside. And you're just going to pretend that you can't spell inside and you're going to replace the S with a C. The way that inside is spelled will clue you into that we're talking about incidence. So if you remember the Mortal Kombat mnemonic, which you should because we just went through it, all you have to do is switch it around so that the lungs are inside. And that way you can easily find out the incidence of the cancers. So for men, #1, prostate cancer, #2, lung cancer, #3, colorectal cancer. For women, #1, breast cancer, #2, lung cancer, and #3, colorectal cancer. So now you have two extremely high yield points down packed. You now know the Mortal Kombat mnemonic and lungs are inside. So you can easily distinguish between the highest cancer-related death causes versus the highest incidence for both men and women. It is also important that you know the lung cancer risk factors. The #1 risk factor for lung cancer is smoking. You also have other risk factors such as radiation therapy. So if a patient had Hodgkin's lymphoma and they had to undergo radiation therapy, they have an increased likelihood of having lung cancer. Another high yield factor to remember is environmental toxins. So when you think of environmental toxins, things like asbestos exposure should come to mind. A high yield fact I want to highlight here is that for asbestos exposure, everyone knows that it's associated with mesothelioma and bronchogenic carcinoma. But examiners love to ask which one is more common, like which cancer is more common in patients that develop or have exposure to asbestos. And the answer would be bronchogenic carcinoma. Aside from risk factors, it's very important that you know that patients with lung cancer usually present in the late stages of their disease, but the symptoms that they present with are cough and dyspnea, and rarely they also can have hemoptysis. And of course, they would have a history of some exposures to some environmental toxins or being chronic smokers. They can also present with constitutional symptoms that we'd see in patients with cancer, such as weight loss, decreased appetite, and fatigue. So if a chronic smoker comes into your office and they're having weight loss, fatigue, cough, shortness of breath, what test would you want to order next? Well, that would be imaging. Some sort of imaging. You'd need to do a chest x-ray specifically. So if you do a chest x-ray and then you see what that white arrow is pointing to right there, which is a pulmonary nodule, then lung cancer should be at the top of your differential list. What examiners also like to ask is that, hey, if you do this x-ray and you see a pulmonary nodule, what is the next best step? And the next best step would be to view previous images. So let's say that they did a chest x-ray 2 years ago and that pulmonary nodule was there and it is the same size, there are no changes whatsoever, then you can think that this is probably a benign lesion. However, if it's increasing in size and there are other changes there, then you would consider lung cancer. And the definitive diagnosis for lung cancer, after you do imaging, you'd have to go in and biopsy that lesion. And that biopsy will let us know what type of cancer it is. Is it a non-small cell lung cancer or is it a small cell lung cancer? Well, we're now going to take a closer look at squamous cell lung cancers. So to simplify this, there are 3 main things that you need to know about all of the lung cancers, right? The first one that you need to know about squamous cell lung cancer is the location. So they are usually central, and they are also described as being a cavitary lesion or having evidence of necrosis. And histopathology would reveal keratin pearls and desmosomes, which are intercellular bridges. It's high to know that squamous cell carcinoma is the most common cause of lung cancer in smokers. It's also high to know that it is related to the release of parathyroid-like protein, and that would lead to hypercalcemia and patients presenting with stones, bones, groans, and that typical presentation of hypercalcemia. So just remember, squamous cell carcinoma, central lesion is a cavitary lesion, can have evidence of necrosis, keratin pearls, desmosomes, which are intercellular bridges. Just remember that because if the examiners are not so nice, they can say intracellular. So just remember, intercellular bridges. So squamous cell carcinoma is the most common cause of lung cancer in smokers. It's related to the release of PTH, and patients can have hypercalcemia and the symptoms of that. So just to put an image to what keratin pearls look like, here it is right here. This is extremely high yield. So just take a moment, pause the video here, and don't forget this image. And if you are overwhelmed by everything I just said, just think of the 5 C's: central, cigarettes, cavitation, calcium, which is high, and keratin pearls. So just remember, central, cigarettes, cavitation, calcium, high, keratin pearls. Now let's move on to large cell carcinoma. So for large cell carcinoma, the location of this is usually peripheral. Histopathology will reveal giant cells and also desmosomes, which are intercellular bridges. High-yield facts that you need to know is that large cell carcinoma can be associated with elevated HCG levels, causing patients to have signs and symptoms like gynecomastia, and also they could have galactorrhea. If a patient has large cell carcinoma, this is a poor prognosis. So when you think of large cell carcinoma, just zoom in and really focus on the large cells or giant cells, large breasts, gynecomastia, large HCG levels. Just think large. Now let's move on to adenocarcinoma. So just like large cell carcinoma, its location is also peripheral. And histopathology will reveal mucin. And if you see like a slide of adenocarcinoma, then you can actually even see some glands as well. High-yield facts that you need to know is that it is most commonly seen in female non-smokers. And an extremely high-yield point to note is that the markers associated with adenocarcinoma. So when you think about KRAS or KRAS, EGFR, and ALK, just think adenocarcinoma. So KRAS or KRAS, EGFR, and ALK. Another extremely high-yield thing to know is the clinical signs of patients that have this. So you will see hypertrophic osteoarthropathy, dermatomyositis, and migratory thrombophlebitis. So a high-yield way that examiners like to test this is that they say a patient presents and they have this rash on the back of their hands. What test would you do next, or what would you suspect? So they're describing dermatomyositis to you, and they're expecting you to connect the fact that patients with dermatomyositis also may have a cancer. So not only lung cancer, it could be cervical cancer, uterine cancer. So just really remember that high-yield point. But overall, adenocarcinoma, female non-smoker with a peripheral lung lesion. And think about KRAS or KRAS, EGFR, ALK markers, as well as hypertrophic osteopathy, dermatomyositis, and thrombophlebitis. Now let's take a closer look at the last non-small cell carcinoma, which is bronchial carcinoid tumor. So the location of this may be central or peripheral. The high-yield facts that you need to know is that symptoms may be due to mass effect or carcinoid syndrome. And you might also see the marker chromogranin A. Don't worry, I'll be going through carcinoid syndrome and other high-yield complications of lung cancer pretty soon. But when you think about the two groups of lung cancer, non-small cell and small cell, remember that for non-small cell, they usually have a better prognosis and they are more treatable. However, for small cell carcinoma, they have a very poor prognosis and it's pretty hard to treat patients with this type of lung cancer. So let's take a closer look at small cell lung cancer. So for small cell lung cancer, the location is central. And when you think about the histopathology of this, think about this cell that I cannot pronounce, but it's very high yield to know. And the high yield facts is that the small cell lung cancer is associated with smoking. They have chromogranin A positive. It's also associated with the L-MYC or MYC oncogene. And it is associated with some very high-yield paraneoplastic syndromes, SIADH, Cushing syndrome, and Lambert-Eaton syndrome. But I really want to zoom in a bit on the markers for small cell carcinoma, because small cell carcinoma is a neuroendocrine tumor. So you can see that patients that have these tumors can have synaptophysin, chromogranin A, and neural cell adhesion molecule, or CD56. So remember, let's just really hammer this home. Synaptophysin, chromogranin A, neural cell adhesion molecule CD56. So small cell carcinoma, it's a neuroendocrine tumor. Synaptophysin, chromogranin A, neural cell adhesion molecule CD56. On histology, you can see small blue cells just like this image right here. So again, pause the video right here, really look at this image and just drill it into your brain. Small blue cells, small cell carcinoma. So I mentioned before that small cell lung cancer is associated with paraneoplastic syndromes. So you can remember with the 3 A's. The first A is ADH for SIADH. So patients who have SIADH have hypoosmolar serum, hyperosmolar urine, and hyponatremia. For the second A, that is for antibodies, and this is in Lambert-Eaton syndrome. You will have proximal muscle weakness that improves with use. So Lambert-Eaton syndrome occurs because antibodies are against the presynaptic calcium channels. This one is extremely high yield because examiners love to confuse the fact that myasthenia gravis is associated with thymomas, while Lambert-Eaton syndrome is associated with small cell lung cancer. So remember, for Lambert-Eaton syndrome, antibodies are against the presynaptic calcium channels, and it affects the proximal muscles, and it improves with use. While for myasthenia gravis, it's the opposite. With use, they just get tired and worse symptoms. The third A stands for ACTH, and this is associated with Cushing's syndrome, obesity, and hyperglycemia. It's very high yield to note that if you do the testing with this, ACTH does not suppress with dexamethasone. Because remember, normally, if you give dexamethasone, this should suppress ACTH. But because it's being produced by this cancer and has nothing to do with anything normal, it will then not be suppressed when you give the dexamethasone. If that was a bit confusing for you, don't worry. Just pause the video, rewind it, and listen to it again. But if you want me to make an in-depth video about this concept, then let me know in the comment section below. And don't forget, if you're enjoying this content so far, power up that like button. And if you are not subscribed, then just click subscribe and that notification bell so that you never miss another high yield video like this. Okay, now we're going to take a closer look at the complications of lung cancer. One of them is pleural effusions. Another complication is phrenic nerve compression. So if there is phrenic nerve compression, you will have flattening of the diaphragm. You can also have recurrent laryngeal nerve compression. A high yield complication is superior vena cava syndrome. So this occurs when there is impaired venous return from the head, neck, upper trunk, and upper extremities. It is most commonly due to lung cancer, a mediastinal mass such as a lymphoma, and thrombosis from catheters. These patients present with face and neck swelling and even conjunctival edema. They may also have distended neck veins, and a commonly overlooked clinical finding or symptoms in these patients are that they can present with headache, dizziness, or confusion due to elevated intracranial pressure. So the treatment of superior vena cava syndrome is due to the cause. So let's say that the patient has a mediastinal mass due to lymphoma, then you'll do radiation therapy. If they have thrombosis from catheters, then you'll do anticoagulation. And if it's due to lung cancer, then of course treating the lung cancer with resection and chemotherapy. So the next higher complication of lung cancer is Horner syndrome. And Horner syndrome is commonly seen in patients with a Pancoast tumor. The most common presenting complaints or sign in these patients is that they have shoulder pain. That's very, very high yield. So patients with a Pancoast tumor, they will have shoulder pain. So let's look at the specific triad or clinical symptoms associated with Horner syndrome. So we can think about this as PAM. P for ptosis, A for anhidrosis, and M for meiosis. Ptosis, anhidrosis, meiosis. So now we're going to look into even more extremely high yield concepts for lung cancers by doing some questions. So let's start with question number 1. A patient with a history of lung cancer presents with swelling of hands and face and jugular venous distension. What is the treatment of choice of this condition? Radiotherapy. So superior vena cava syndrome is most commonly associated with small cell lung cancer. So it's extremely high yield that you know that this patient presents with the swelling of the hands and face and the venous distension. These are signs and symptoms of superior vena cava syndrome. A patient with a history of lung cancer presents with unilateral meiosis, anhidrosis, and ptosis. What is the most likely diagnosis? Pancoast tumor or Horner syndrome. Whichever one that's presented as an answer choice, then that would be the answer. Of course, on exam day, they would not be so nice. But it's important to note that this is most commonly associated with squamous cell carcinoma that compresses the superior cervical ganglion. If a patient has a pleural effusion with malignant cells, what is the stage of lung cancer? Stage 4 lung cancer. What FEV1 is needed to do a whole lung resection? FEV1 greater than 1.5. What is the most likely diagnosis of a patient with popcorn calcifications in the lungs? A hamartoma, which is benign. So a patient with a 40-pack-year history of smoking presents with a 3-month history of weight gain. Physical exam reveals skin hyperpigmentation and purple striae. What electrolyte abnormality may be seen in this patient? Hyperkalemia. A patient with a 40-pack-year history of smoking presents with difficulty rising after sitting down. Physical exam reveals bilateral lower limb and upper limb weakness that improves with movement. What tumor marker can be present in this patient? chromogranin A. So if you remember, this is describing Lambert-Eaton syndrome because it is improving. The symptoms of weakness are improving with movement. And that is most commonly due to small cell lung cancer. And remember that with small cell lung cancer, it is a neuroendocrine tumor associated with neuroendocrine markers such as chromogranin A, synaptophysin, and CD56. And that brings us to the end of this extremely high yield review on lung cancer. If there are any other topics that you would like me to review, then please leave them in the comment section below. And remember that if you are a member, then you are able to vote or even give suggestions on the next video that I will upload. And you also get first dibs on me replying to comments and everything. So please be sure to power up the like button, hit subscribe and that notification bell so that you never miss a video like this. And don't forget to click join so you become a member and get some special perks from this channel. And to continue learning more, just click this video right here.